So, dear friends, just now we have seen one case of ACL tear, anterior cruciate ligament tear after trauma. Patient, a obese patient, very obese patient, in fact 104 kg, 5 kg weight. And he got an accident and his left knee was absolutely swollen. There was damage to the meniscus, there was damage to the anterior cruciate ligament, and his knee was swollen like a big, it was looking as good as a it is a leg of an elephant. That much swelling was there. He was admitted in Pune and never have a reduction in his swelling. Doctor said that he should get operated, but they cannot do the operation unless and until the swelling reduces. So one of my patient asked him to take my opinion. He came right from there, from Pune to Sangamner, and last month, 1 month back, I took his case. I started with him with a remedy. I was damn sure that he will get settled within a month. And today, just now, we have seen the follow. The total swelling is reduced. It was looking like a knee now. It was never looking like a knee earlier. So now it has been completely reduced. And this remedy never failed in such types of injuries. And the remedy, which is very important in ligamental tears, very important in meniscus tears, very important in traumatic affections of the joints, traumatic affections of the periosteum. The remedy is Ruta Graveolens. So Ruta is a very important remedy, one should not forget. So I want to teach this Ruta because Ruta has a good depth. We used to consider this remedy is only useful for the purpose of injuries or joint pains or rheumatism, all those things. But it is not so. This is a remedy which has so much of depth that it covers the cancer miasm and it covers the cancer of lower bowels also. And that's why this remedy I used to use very often in my practice, even in pathological cases. So why not to learn sentence by sentence from the Borix Materia Medica? So let us go ahead with the Borix Materia Medica because Boric is very clinical book which defines everything. So Ruta Graveolens, it is a root bitterwort. It is plant remedy. It acts upon the periosteum and cartilages, eyes and uterus. See, this first sentence defines the action of the remedy. Periosteum and cartilages, two important things. Then it has very specific action on the eye as well as uterus. Complaints from straining of flexor tendons especially. So flexor strain, so it is very good remedy for the golfer's elbow. When flexor tendon affection is there, the most common injury, which is golfer's elbow, and this remedy plays a very vital role. If it is extensors, sprain or strain, then Rustox is the remedy. So this is too important. When you correlate a remedy from clinical standpoint, then you can very easily judge the remedy. Tendency to the formation of deposits in the periosteum, the tendons, and about the joints, especially the wrist joint. So this is a remedy which has a gouty concretions also. This is a remedy which covers the gout. It has a gouty deposits. It has the rheumatic nodules also. So you can get such types of deposits, especially on the wrist. It is one of the important remedy for the ganglions. You number of times you give the Ruta and ganglion disappears. This is very specific. Other than there are many other remedies, but this is very specific remedy. Overstrain of the ocular muscles. There are many patients who used to complain, my eyes are painful. Earlier I used to laugh, but when this happened to me, I understood there is a pain in eye also. So for one patient, I have given the Ruta, and after giving the Ruta, immediately the pain stopped. And Ruta is very good for the eye strain. Those who used to work in front of the computers, in front of the TV, and they get the pain. This is a remedy. It's do the wonder. All parts of the body are painful as if bruised. So this pain is like an arnica. Whole body it pains like bruised. Sprains after arnica. So sprains after arnica, and I used to utilize it along with arnica. I never use alone whenever the such types of joint traumatic joint affections are there. I used to use both the remedies, arnica which absorbs the hemarthrosis and Ruta covers the cartilage damage. So both remedies together makes the change in the patient. And that's why I suggest that sprains and whenever the joint pathology is there, arnica with Ruta. Lameness after the sprains. Lameness means weakness, and weakness due to the pain because of strains, jaundice, feeling of intense lassitude, weakness, and despair. And all those things, feeling of weakness, feeling of lassitude, the despair state, these are in relation with the pains in the joints. Injured, bruised bones. So this is again a very, very, very important remedy. Last time we have discussed symphytum. Along with symphytum, Ruta is one of the remedy one should think in the injuries to the bones. If the fracture is not there, but the injury is there and bone is affected, Ruta plays more important role than the symphytum. Head complaints, pain as from a nail after excessive intoxicating drinks. It is very close to the thuja. Thuja is also having the headache as if nailed. Periosteum sore, epistaxis. So this is also having the epistaxis tendency, bleeding from nose. Eye complaints which are very important. Eye strain followed by headache. The eyes are red, hot and painful from seeing or reading fine print. So when you used to use the laptop more commonly, you used to get eye pain very commonly. So eye pain is when you use the desktop, it never happens. But when you use the laptop, the printing is the writing is very fine, and that fine writing creates the eye strain. Ruta plays very vital role. Natramur and argentum nitricum are mentioned. Disturbances of accommodation. So accommodation means what is the disturbance of accommodation? At one time you used to see near object and immediately for longer object, and there is fraction of second you can adapt that. If it never happens and it takes some time, then problems arises. Then person cannot adjust that. That type of problems are covered with the Ruta. Very pain while reading. Pressure deep in the orbits, tarsal cartilages feels bruised. Pressure over the eyebrow. Asthenopia. This word is having the meaning. Asthenopia. It is the exhaustion of the eyes. Eyes get exhausted, and patient says, "I don't want to open the eyes. I want to make it close because it is paining. It is aching." That is asthenopia. Stomach. The gastralgia of the aching, gnawing character. Urinary symptoms, the pressure in the neck of bladder after urinating, painful closure like apis mellifica, constant urging to urinate, feels bladder is full. So this is the remedy which acts on the bladder wall, and that's why the pains in the bladder can be covered with this remedy if other things are associated. Most important aspect which I want to teach you in today's session, other than the joint pathology, is its action on rectum. I have treated a case of CA rectum. The fellow was a doctor who was suffering from, he was in agony, operated. He never took the chemo because first he took one chemo and he affected so much and he stopped the chemo thereafter and he was in agony. I started him on Ruta, and with Ruta, he nearly about 3 years he survived without without the pain, or in fact very less pain. So Ruta has very specific action on rectum. Difficult feces evacuated only with when straining. Constipation alternating with mucus through the stools. Discharge of the blood with stool. When sitting, tearing stitches in the rectum. Carcinoma affecting lower bowel. This is too important. This indicates this remedy has the power to act on the lower bowel, and it covers the carcinoma. And I have utilized it many cases of cancer. Even I have generalized this symptom and utilized Ruta in even in whenever the metastasis is there in the bones and pains are never getting settled. Ruta plays very vital role. So because it has that much of depth of covering the cancer. Prolapsus ani every time the bowels move after confinement. So this is again good remedy for prolapsus ani other than the podophyllum, and it works. Frequent unsuccessful urging to the stool, protrusion of rectum when stooping. So this much loss of strength at the anal level, it is there. Anal sphincter gets affected, and rectum comes out whenever he stoops. Respiratory, the cough with copious thick yellow expectoration, the chest feels weak, painful spot on the sternum, short breath with tightness of the chest. So there is tight feeling, the cough is there, the secretions are there, but not having so much marked action on the respiratory. Now, the basic action, the back and extremities. Back, pain in neck, back and loins. Back is better by pressure and lying on back. These patients used to tell you that I used to lie on the bed and I keep something hard below my lumbar region, and then I feel better. Ruta is very specific for such a thing, and there are many patients who used to do that thing. Lumbago works in the morning before rising. The extremities, yes, all the symptoms which are very important. Spine and limbs feels bruised as if something trauma has happened. Small of back and loins pains. Where is the small of back? So small of back is belt area. It is the lumbosacral area where the joint junction is there. That is called as small of back. Ruta has very specific action. It produces even in ankylosing cases. It works beautifully. This has very specific action over there in small of back. Legs gives out on rising from the chair. Hips and thighs so weak. So whenever patient wakes from the sitting position, he gets very severe pain in the hips, he gets severe pain in the knees, he gets severe pain in thighs. And that difficulty, there are three remedies. One is Kali carbonicum, where you can get the back and legs gives out. Aesculus, again the same symptom, back and legs gives out. All of these remedies have a very much pain in lower extremities, and that's why the talks in Marathi, you have that sentence, कंबर पर कामात न गेली, पाय पर कामात न गेले. This is very typical sentence which has been converted, back gives out or limbs gives out. Phosphorus and quinine, two remedies which are mentioned for the weak thighs. Contractions of the fingers because of the joint pathology, pain and stiffness in the wrist joint, the hands, ganglion, and benzoic acid is mentioned over there. Ganglion, I have number of times I have covered ganglion with the help of the Ruta. It works so beautifully with the sciatica, worse lying down at night, pain from back down the hips and thighs. So this is the remedy for lumbar backache, sometimes prolapse intervertebral disc associated with sciatica, and worse by lying down, and pain from back down the hips. Hamstrings feel shortened. This is a symptom which is close to the graphitis. The hamstring spasm, sprain, which is covered with the Ruta. Generally, this is very good remedy, a sports remedy. Tendons are sore, aching pain in tendo achilis. Tendo achilis pain, this is again common. Calibicromicum is one remedy, one should not forget. Where there is tendo achilis, it has specific action. Ruta is also having the action on tendo achilis. Thighs pain when stretching the limbs. So whenever you stretch the limbs, the thigh starts paining. This is very typical with the Ruta. Pains in bones of feet and ankle. Great restlessness. Restlessness is due to the pain in the lower extremity. Modalities. Modalities are worse by lying down, worse from cold and wet weather. So modalities are very close to the rust talks. These are two remedies, but one is deep acting, one is short acting. Rust is short acting, rust is acutely acting. As comparatively, Ruta is deep acting. It covers the pathology. Relationship, compare the Ratania for rectal complaints, Cardus mar for liver complaints, rectal irritation, Jaborandi, Phytolacca, Rus, Cilicia, and Arnica. So these are remedies which have direct action on joints and pathologies over joints. So those are he explained over there for comparison. Antidote is camphora and complementary is calcarea first. So if the patient settles, give the calcarea first, and that covers because that is more defecting than the Ruta. Dose is first to 6 potency locally, the tincture for the ganglia and as a lotion for the eyes. But I have never used it locally. I have used this remedy in 1M potency or 10M potency more commonly in frequent repetition. Whenever the bony pathologies are there, it requires penetration. And whenever it requires penetration, you have to go for the higher potency. This is simple logic. And this, when you repeat, it definitely works, and it works very fast. And that's why this Ruta should be there in with everyone in higher potencies in such types of injury cases. So that's all for today. Thank you very much.